In today's class, we are going to see the next type of endoscopy, that is gastroscopy. The learning objective of today class is that first we will be discussing the different challenges of gastrointestinal, and then followed by we'll be discussing the solution, and then we will have a clear discussion on why this diagnosing method like gastroscopy is needed, and how does it works, what is that actually the gastroscopy is all about. That everything we will have a detailed explanations of about this topic, and then also we'll be discussing what is the essential important tools and equipments of this gastroscopy, and how does it supports the patient's comfort and quality of life. And finally we will wind up this topic with a discuss with a short discussion on advantages and benefits of using this gastroscopy. So let's start with the empathy perspective, understanding what type of challenges which is there related to gastrointestinal problems. So initially, the gastrointestinal problem is something like it's unusual thing because many people for no reason they will have a stomach pain, acidity problems, bloating, and so on. So initially they will not very serious about that, but later stage if we don't have a yeah, very later stage it will end up with some other severe problems. So in such case they are very they don't have any clue, literally they have confused with what type of problem is there. Even the doctors with the help of x-rays and ct and mri, it is not easy for them to diagnose what type of problem is actually is there. They are very uncertain about this problem. That is which is considered as one of the challenges, because unless until the doctors will see the internal organs indirectly, they would not conclude the decision, or they could not able to give the solution for their problems just by seeing the their later symptoms, and also with by seeing the x-rays and imaging reports. So there are certain cases which is really recommended, or which is where there is high need of such technique like laparoscopy to visualize the not laparoscopy, gastroscopy, to visualize the internal problems under abdominal cavity. So here comes the gastroscopy plays a very important role to identify the problems and to see the texture of the stomach organs. By means of that, the doctors which can easily relate what type of problem is there, and they can give the treatments accordingly. So this is how the problems is being identified, and they come to know what is the need by doctors and peoples. That is a very minimal safe technique is needed to visualize the internal organs right from esophagus, stomach, and even abdomen. So here comes the solution, that is the gastroscopy. So we identify the problem, then we come to know what is the need, which is to give the solution for the problem, and then the solution is that which is nothing but gastroscopy. So how does this gastroscopy works? It's very simple. As like the other endoscope, the gastroscopy is also one type of endoscope which is especially designed for gastrointestinal problems. That is right from esophagus, stomach. We will see all kind of elements with the morphological changes. You can also see any fluid accumulations, or that is morphological changes and textures and everything directly with the help of imaging system. And that is, we have the lens in the flexible end of the flexible tube. Outside we have the monitors. We can see the everything in real time. So first one, we have a flexible design that as like the other endoscope it has. And then we have to insert the endoscopy gastroscopy slowly through the natural opening, that is through the mouth, and then pass it on to the esophagus. So through the navigations in the real time, we can see what are the things being changed through in their path. Since it's been traveled all the way from the esophagus to the point of the target area till duodenum or a complete digestive tract. So we can easily see where actually the problem is there, what type of changes happened, what is there any infections, or if there is any abnormal growth, that can easily visualize and examined with the help of the monitor which is outside, which we have kept outside. So that is how the clear visualization is being made. And then last we can do with the treatment options, like we have the other channels, working channels, which have the provision to deliver the medications. And also we can collect the samples for biopsy to see what type of problem is there. So essential equipment, that is a tool, is that we have a endoscope, that is one thing. And second, we have a light source. Here we can use it either LED or xenon light to have a clear illumination of your internal structures. And finally, we have a video system which have a capacity of recording as well as displaying the real-time images with very good high resolution video processing capabilities. So what are the supporting system for this gastroscopy is that we have the option provision of air water system. So this air being used to inflate the stomach to have a clear visualization. The water, that is irrigation system, which is being used to clean the areas to the that is targeted areas, or the path through which it travel. So it clean the blood and other mucus, and all, even it can clean the lens, because once it's being injected, it may be covered with blood or some other fluids. So that has to be clean to have a clear capture of your internal structure. So that is where this water system is going to help out to clean the path as well as the camera system to have a clear visualization. And second one is suction channel. This channel, as I said in last class, that it's been meant for to remove any excess excretion, secretions are there, or a blood or fluids, so that we can have a very clear visions throughout the examination. And then we have a other accessory tools, which is called as specialized instruments, like biopsy forceps, injection needles, which is used to which is used to take any biopsy, or you can give any treatments, or to have any grip to see all angle of your area. So that is so that this way that's why this accessory tools will be used or utilized. So the procedure is that it is same like all the endoscopy. First we have to do preparation, like we have to give sedation to the patient and then make them feel comfort before starting the procedure. Then we will slowly insert the endoscope through the mouth, and then we will start to examine. Before examination, we will slowly first we will send any sort of air, for example a CO2 or other specialized gas, so that we can have expand cavity to have a clear visualization of a inside, so it enables the doctor to inspect thoroughly all the areas through the monitor. And then finally we have a treatment and recovery. So treatment based on the problem or the inspection which is being carried out by the doctor, the treatment will be given, or treatment or procedures will be performed. And then we have a recovery process here. Once all the examination is being done, the doctors comes once the doctors comes into conclusion, the recovery procedure is being involved with removal of gastroscope safely. After that, the patient is monitored for any discomfort for 1 or 2 hours, and then once everything's fine, we will send them back to their home to carry. And then the patients will also carry out their daily activities without any trouble. So this is like a 1 day procedure or 1 day treatment. So this how this gastroscopy standing top leading a procedure in case of diagnosing the problems. Yeah, yes, that is how the gastroscopy is working on. The second one is like we have so many yeah, benefits because the gastroscopy, we are making very minimal invasive type, so which enables the direct visualization, and we can for biopsy, which helps to take accurate sampling only from the targeted area. Once everything is done on the same procedure, and the same day we will start the treatment. So immediate treatment will leads to immediate recovery from that problem. So this how the gastroscopy gives very important impact on a patient's health and their life. So the advantages like other traditional procedures, it is minimal invasive, invasive, and it is quick and efficient. That is very much important. As far as the medical concern, how quick you are diagnosing the problem correctly, you can go with quick treatment and efficient treatment. So same day if we start the treatment at early stage, the survival rate and the recovery rate of the particular person is very high. So that is what's even 1 second 1 minute matters a lot as far as the medical concern. So this in this point, the gastroscopy is giving very quick analyzing of the problem and efficient treatment, and also it's highly effective compared to the other traditional technologies. So finally, I have a small activity later to this topic here, that is think passion challenge, which is being posted to the class, to the students. Here, the individuals will make will ask will individual students being asked to research about one advanced techniques in gastroscopy, which very much have very which have very much impact on patient comfort and diagnostic accuracy. So then they will pair up with each of their friends to see what are the I mean, they will have a short discussion. They will have a small brainstorm section among they two to what are the information is being collected to share, and then and then these two will come in front of class to disseminate the knowledge of what are the points is being collected to the given topic. So as a result outcome is that all the people will get to know what are the advancement is there in the gastroscopy related to different companies, which is who is making this making or working on this particular topic. So then we have assessment related to this topic. Finally we have come into summary of this today class is that right from beginning we started with what is meant by gastroscopy. Before that we discussed empathy perspective of this particular topic, that is what is the common worries and fears of the people, like patients and also the doctors, why they demanding this particular gastroscopy, what is the problem, and we define the problem, and we define the need, and then we come to the solution, that is the gastroscopy. Then we get into the core topic of gastroscopy, that is why, what definition, how does it works, and what is the different types, and essential tools and equipments, and also we discuss the different procedures, and finally we closed with what is the key impacts and the benefits of using this laparoscopy. Yes, thank you.